All right, and good evening, everyone. Welcome to tonight's webinar, which is the last of a three-part series titled SiHy One Day, The Time Is Now. I'm your host, Dr. Steve Rosinski, Senior Manager of Professional and Academic Affairs at CooperVision. The first week, we discussed the health and safety opportunity with SiHy One Days, while last week, we discussed why quality matters more than ever. Tonight, we'll be discussing the topic of simplifying wearing experiences. Because convenience is key right now, both patients and practices are adopting new behaviors. We will learn more about the convenience that SiHy One Days can bring to your practice and your patients, and tools to reduce chair time and maximize fitting success. Just like last week, we have three of your peers here to share their insights. First, we have Dr. Jack McIntyre of Dr. McIntyre and Garza, located in Corpus Christi. Thanks again for joining us for this third week in a row here, Jack.
Absolutely.
Next, we have Dr. Drew Provost at Great Hills Eye Care in Austin, Texas. Thanks again, Dr. Drew.
Thanks for having me, Steve.
And last but not least, I think I've said that 3 weeks in a row now, Dr. Jennifer Stewart of Norwalk Eye Care in Norwalk, Connecticut. Thank you, Dr. Jen.
Thank you.
All right, so let's kick things off here. And I'll first go to, I guess, Dr. Drew, since he's on the top left here of my screen here today. And I think I told him I was going to call him first this time. So in terms of convenience, in your opinion here, Dr. Drew, what benefits do you think SiHy One Days have as a convenience factor? What do they offer your patients?
Well, overall, Steve, I think they offer my patients a really convenient wearing experience. Just the ability to not have to worry about taking care of their lenses. They can, know that they're going to have a fresh lens every single day. And, that convenience piece really goes into the comfort of the lens. Just this last week had two back-to-back patients that ended up doing a whole annual supply of My Day Torics. And it really hit on that convenience and comfort part for them. And really what solidified it with them was, what's the most comfortable day that you wear your lenses? And both of them said, well, it's that first day. And they were looking for that more convenient, more comfortable option. So that's really where it's fit in, where SiHy One Days have fit in with my patients.
No, that's a great point. You said it's that first day, right? And I remember just when, if you have that monthly or that 2 week patient, right, from that standpoint, a lot of times patients note that maybe the overall performance of the lens just isn't as good towards the end of that wearing cycle. But I love what you said, talking about it's that first day. How would you like to have that first day every day, right? So that's huge. Dr. Jen, Dr. Jack, thoughts there?
I'd say health. I think with such a focus on health right now, it's just a no-brainer to me to fit a patient in the healthiest lens available. And, we've talked about it the last couple of weeks, and I remember when, I give people homework and then I try and do it the next day as well, that, we have such a focus on hygiene and we're talking about health more than ever. And I think it's just such a win-win for us and our patients to have the best, healthiest lens in the most convenient wearing schedule. I mean, who wants to reuse a lens after they've been at Walmart and Costco and, out in public and then put that lens back in the next day? So, that conversation about health and convenience and putting them in the healthiest lens possible, it's just been easy, since COVID, since we've been back.
Yeah, it's really the ultimate inconvenience. I'm the old one on the panel. And so when I started wearing soft lenses, we had to buy distilled water, salt tablets, make the saline, and then put it in a heat unit. So the thought of doing all that now is just open a package and then throw it away. The other thing is, a lot of people don't even want to go to the store. So yes, they could do delivery and the other stuff, but I think they're thinking about all of this now with COVID. It's really changed a lot of things very suddenly, just like that, you just need your lenses. You don't need cleaners, solutions, and anything else. So I think it's the way to go.
So in terms of how your practice can benefit, right? How does that work with you for your practice? How is that? How would you say SiHy One Days had their role in helping your practice then?
I think it's just such a huge referral base. I have patients that I fit in a SiHy, and then they tell, their friends at school or their coworkers, and, they don't go back and say, Dr. Stewart fit me with a SiHy lens, but maybe they do, but, they go back and say, wow, I've got this great lens that, people are still amazed that you can throw a lens out every day. I think we make the assumption that our patients know that's available. And every day I have a new patient who, when I ask if anyone's ever mentioned the lens they throw out daily, they about fall out of their chair. So, I think we make that assumption that patients know it's available, and we assume they don't want it if they're not asking. But if we're not bringing it up, they have no idea. So, I think it's such a great referral for our patients. You get these patients coming in saying, I want the lens that you fit my friend with. And on the flip side, I know that I'm providing them with the healthiest lens possible. And so I think it's a win-win for both of us. We get this growth in our practice, but we also know that we're doing the best for our patients.
Doesn't that give you does that make you feel good inside though too? And when you just offer that to that patient, they had no idea. It's like, it could be a game changer, like a complete wearing experience overhaul, I would say. Yeah. So, I mean, how about Dr. Drew or Dr. Jack in your practice? How has that benefited you?
Yeah, I think from an efficiency standpoint, from fitting it, and also the fact that we're trying to reduce the chair time, not just because of COVID, but just for overall efficiency of the practice. When you can really reach for that healthiest, most convenient, most comfortable option for the patient right away, and be able to offer them that, we've noticed that we've had a lot less contact lens follow-ups. And just overall, on the back of what Dr. Jen was saying, just happier patients. So I think from a practice efficiency standpoint, as far as fitting the lens, that's where we've seen a big improvement.
Yeah, for sure. And I think along with all that, anytime you can differentiate yourself with services or products that maybe other people in the area don't do, and so even if they decide not to get the 1-days, which isn't very common, you've given them the option. They're super comfortable, super easy to do. And as you mentioned, the efficiency is just incredible. You can just mail it to their home and stuff. So it's really hard to beat, I think.
Now, how about patient retention, right? I know how important that is, maybe now even more than ever before. There's a lot of disruption in the marketplace right now. And so I'd love to kind of hear your thoughts on if by prescribing silicone hydrogel 1-days, how does that come into play with retention as like a retention tool?
I guess I'll go first again. I just always jump in. So, we all know that it takes more to acquire a patient. It's more costly to our practices to acquire a new patient than it is to keep a patient in our practice. And, I just think with SiHy lenses, again, you have these happy patients. Why would they go elsewhere? If you're giving them a lens that's comfortable on day one, they can wear it the long days that we have with patients working from home. And they know that you provided them with the best technology because we're telling them that. I'm telling my patients, this is the best lens out there. It has the best technology. It's the most breathable lens, sharpest optics, and most comfortable. Why wouldn't they come back? What experience would they be looking for in somebody else's practice? So I think part of our job is to tell them why we're prescribing that lens for them, so that they go home and say, you know what, Dr. Stewart gave me this lens because of these reasons. And I think at that point, cost is much less of a factor, because we all want this personalized experience. So if we're giving them the reasons why we're prescribing the lens, we're giving them our personal recommendation, there's really no reason for that patient to leave and to go elsewhere.
That's a great way of putting it. I love that.
Yeah, now, I think in any kind of healthcare, habit is very important. So once the dentist gets the patients used to 6-month visits, your physician hopefully gets you in the habit of yearly exams and blood work. I think as ODs, if we can really get people thinking in terms of the annual eye exam, in my experience, the 1-days are more compliant with just throwing them away. So you don't see people rolling in after 26 months or something. So more compliant. And then if you give them a good experience, they get comfortable with you and your staff, and it just gets to be, I'm here for my annual eye exam habit, like the dentists have been so good with. So I think it helps with that also.
Yeah, and to segue on that, I think the interval is down, so we get that annual exam more often coming back. And also with what Dr. Jen was saying, with the explaining to them why we're putting them in the SiHy one day, we're really having that health conversation. And I know in our practice, we're really stressing that annual wellness exam. And so being able to segue from the health of the contact lens that we're putting the patient in into they also need to come back to monitor their ocular health every year has really reinforced it for our patients and helped our practice.
And do you both find that you're having less dropout from your patients too? Do you find that, not only are we getting them staying, coming back to our practices, but do you find that those patients are buying those annual supplies? Do you find that you're having less of those patients dropping out of their contacts?
Well, for sure. I even say, if you can't wear a one day, what can you wear? Right? I mean, as opposed to a 3-month or a 1 month or even a 2 week, if you can't wear a lens that's absolutely clean every day, then either your allergies or something is so bad you can't wear anything. So yeah.
That's what we found. We just find we get less dropouts in those patients. I always call it the slow dropout. They're not stopping wearing, but they're ordering less. And I don't see it with my SiHy patients. They're happily wearing those lenses every day. They're not the ones who are, I'm working from home, I'm going to leave my glasses on because my eyes are dry. They're the patients that want to wear their lenses. So, we've just found there's been less dropout as well overall with wearing the SiHy lenses.
Yeah, no, and you all understand the value of what a contact lens patient brings to your practice, right? So you don't want them dropping out of contact lenses at all. And, and when we think about like the value of what a contact lens patient brings to your practice from a standpoint, even financially, right? Over like, let's just say a 10-year period, right? Because if we think about it, your average contact lens wearer comes back to your office every 12 to 16 months and, shorter on that, close to the 12 months for maybe closer to with a one-day modality, right? But we think about a glasses wearer comes back every 24 to 26 months, 28 months, right? And Dr. Drew, you brought up a great point talking about how that is a great segue to now be able to monitor their ocular health, right? So yes, there's definitely that financial benefit, right? But also there's the benefit of really being able to assess their health, right? And, I know Dr. Drew, you really, you speak to that with most, I'd say all of your patients, right? When it comes with having that opportunity, but that just increases that much more when you have patients wearing contact lenses because you're seeing them, 8, 9, 10 times over that 10-year period versus a glasses wearer you're going to see 4, 5, 6 times over that 10-year period as well. So no, I love it. I love it. So, when it comes with, patients dropping out of contact lenses as well, I know Dr. Jen, you brought this up last time and how I love to, I just want to bring this back up again because I loved how you talked about how you have that conversation with the patients of trying to address it right at the get-go, right? If they're you're noticing that they're not maybe wearing their contact lenses as much, or they're not purchasing the amount of lenses that, your supply would be. So, just for the audience here, would you mind just kind of reiterating that again, how you go through that? Because I think that really is important. It's kind of like stopping and pausing, right? And saying, let's reassess the situation.
Yeah, I think, paying attention. I always look, in our office, I have access right in the exam room of what they've been ordering. So I look and see, Mrs. Jones, are you ready to order your annual supply? You know what, Dr. Stewart, I still have 6 boxes left. And I'm like, well, you ordered, a year's supply last year. So, easy math. I noticed you're not wearing them every day. Is there a reason why? And, and just addressing it and getting in front of it. And I think, patients don't often want to disappoint us or tell us that the lens they fit us with, we fit them with is not as comfortable. But I like to get in front of it and open that conversation and say, have you just been wearing your glasses more, or is there anything I can help with? Oh yeah, I've been working from home and my contacts have been really dry in the afternoon, so I just stopped wearing them. They're not dropping out, but they're wearing them way less, and that's my slow dropout patient. So you're getting in front of it and addressing it before they become that dropout patient. I think the patients who have given up on contacts are just very difficult to get back in. But if we can kind of slow that down and jump in before they become a dropout, we've seen such success. And I think they turn into my biggest champions. And they're the patient who said, oh my gosh, Dr. Stewart realized I was having an issue before I even noticed. jumped in and fit me with this great lens. And I think before they become a patient that leaves our office, now they become one of our biggest referral sources.
Yeah, and that segues, perfectly with, what Dr. Drew was saying when it comes with the importance of, having that opportunity to see that patient on a more regular basis in a shorter interval, because then, having that shorter interval, you can start recognizing it, quicker, right? As opposed to, waiting that they come back, 2 or 3 years later, then all of a sudden they're not wearing their contact lenses at all, right? So, but wonderful. So, I know there's definitely, we're talking about a lot of ways in which we could minimize chair time, maximize efficiency. I would love to discuss maybe tools that the three of you are utilizing in your office to help reduce chair time and maximize fitting success overall. I'd love to hear maybe, what the three of you are doing with regard to that.
I'll let you guys go first.
Well, I think one thing we've done, Steve, in our offices, especially with the SiHy 1-days, is we've been able to identify the lenses that have been working so well for us, and really have, I've gotten together with all the doctors in the practice, and we've really said, hey, this is what works, and we're going to continue using this, and really hone in on what's giving us good results. And because of that, it's taken out a lot of the noise in our practice. And it helps the staff as well, because then the staff gets used to the lenses that we are prescribing most, and they see that it's consistent across the doctors in the practice. And, of course, everybody's different, right? So everybody might need a different lens, but for the majority of our patients, we have a handful of lenses that are working very well. And so that's worked great for us from an efficiency standpoint. I wanted to point out one thing that you commented on about the reducing that interval, and is that if you look at your patient base, and we might all have thousands of patients, right? But if you just reduce that interval by even like 2 months, you wouldn't have, some of us wouldn't have room to see all those patients, right? So that's an interesting thing you can do when you go back to your practice and look at that, and you'll start seeing why it's so important to get that interval down.
Yeah, that's a great point too, because if you do the math on it, those intervals, even a little bit, and you're doing pretty well. One thing that I found useful, I have my contact lens manager has been with me for 26 years, so and she's not shy about telling me what she thinks of me or the practice or anything else. So, but a lot of times, I have great ideas and I'm sailing along, and she's in the trenches, so they see the returns, and sometimes, like, the doctor wouldn't even know about it. The patient just comes in and says, here's my boxes back, I want a refund. And, we're in the back merrily going along, what's better, 1 or 2? So I've asked for her feedback so we can close the loop and say what lens are working, which isn't. And then, just like what Dr. Drew's doing, I get with, the other 8 doctors and just say, this is what's working and this is what isn't. You're free to fit however you want as a colleague, but this is what's working. And, so it works out really well that way to get the staff input.
For our office, I think the biggest tool that I use that, is by my side every day is Optic Expert. And, I was resistant for a little bit because I think, I can do this, I can, fit, I know the numbers and I can do it well. And, it took me a little time to use, and now I am lost without it. And, we utilize scribes in our exams. So my technician's sitting right next to me, and as soon as I'm writing out the refraction, they know to pull out Optic Expert, and they're already inputting the prescription, and they're waiting for me if it's a multifocal. They know I'm going to check dominance. They input the prescription, I glance down, and they go and get the diagnostic lens. By the time I'm done with slit lamp, that lens is sitting up at the sink with the foils open, and the patient can just go right there and put them on. So, we've honed that in and made that such a efficient way of practicing. And again, to your point, Dr. Drew, if you take the number of exams you're seeing, and if I shave, 2 minutes off each of my exams by doing that, over the course of the day, how many times are we seeing a patient and thinking and, figuring out our math? And, if we can do that and be 2 or 3 minutes quicker per exam, how many extra patients can we see? Or can I take those 2 or 3 minutes and talk about second pairs? How can we be more efficient? How can we be more effective? and how can we either move those patients through our office quicker or utilize that time to add an additional service. So, for me, Optic Expert not only saves me time on the exam room, but then, the patients aren't coming back because I'm usually hopefully getting it pretty close to right the first or second time. I don't have the staff time of unhappy patients calling. So, if you were to add up all of the time each patient is saved, each patient encounter is saved by Optic Expert, it's unbelievable how much time you can save just using, a simple click on an iPad.
And even having the opportunity just to even maybe you get lunch that day as well. But for those of you that maybe aren't as familiar with Optic Expert is an app that is found on the Google Play or Apple the App Store. It also has a desktop version as well that has a toric and multifocal calculator in addition to some other useful functions as well. So no, but thank you for sharing that, because I mean, like you said, anytime that we can increase efficiency and our patients are happy, we're happy, right? It makes things that go that much more smoothly. So, as we continue on here, I know that, our last webinar, we spoke about why quality matters more than ever, right? And Dr. Jack, I know you've talked with me about this, and I know that now you're doing some more remote follow-ups for certain services. Would you mind telling everyone how that has been going, or what you're hoping to utilize this for continuing in the future? Just love to hear some of your feedback that you've had with utilizing some different technology.
Right. I think COVID really hit us right between the eyes as far as what we were ready and what we weren't ready to do. Online ordering. If you didn't have online contact lens ordering, you're in trouble. I had toyed with telemedicine a couple of years ago, but we're open 7 days a week. So I couldn't figure out how it would be useful in my practice. But where we started, so we're looking into it as far as perhaps some of the myopia management visits, some of the scleral visits, some of the non-emergency medical visits. So we're going to keep looking at it. It's here already, and I think all ODs really need to look into it, because even if we don't have another COVID, people are asking now. I mean, I'm having family members from up in Houston say, hey, can you do an eye exam on your iPad? And I go, well, no, because we're not going to do the eye exams on it. But I think for follow-ups, I think we all can kind of look at it. And we have a list of ones that, if you are a painful eye, no, you need to come in. But, Corpus Christi is in the middle of nowhere. I mean, there's nothing for 2.5 hours. So we have a lot of rural patients that I don't want them to drive for an hour and 15 minutes because they have a subcon heme or something, or conjunctivitis or an allergic conjunctivitis. So I think we're going to keep pursuing it and going with it more and more in the future.
No, I mean, we appreciate those insights, right? Because, as we continue to evolve, right, your practices are also innovative, and I imagine your patients are, like you said, Dr. Jack, they're asking for it as well, right? They're asking for it, and in order to continue with what our patients' needs are, be able to bring technology like that to them is beneficial. So anything else that the three of you would love to share before I kind of wind things down a little bit and talk about an exciting new webinar series that we are starting after this?
I just wanted to echo what Dr. Jack said. If you're not offering direct shipping to your patients, that's my homework for tomorrow for everybody. I mean, contact lenses are what kept us afloat for the time that we were closed for routine care. So whether, on our website, patients can go right on our website and contact us directly to order lenses, whether you use Lens Ferry, however you're doing it, increasing the efficiency, but again, going back to what we talked about, increasing the experience and increasing a way that we can differentiate ourselves. So, no one wants to come in. We don't want extra patients coming in. And if we can provide a valuable service to our patients with direct shipping, I agree with Dr. Jack. If you're not doing it, tomorrow you should go start.
Well, wonderful. Well, thank you. I would just like to thank you all for joining this 3-part webinar series on SiHy One Day. The time is now. I can't believe these 3 weeks have gone by so quickly already. But for those in attendance, we will be sending out emails with links to the 3 webinar recordings when they are available on CooperVision's ECP Viewpoints. And beginning next week, as I alluded to just a little bit ago, CooperVision will be kicking off its new ECP Viewpoints peer-to-peer virtual learning series, which is a collection of educational sessions presented by eye care professionals for eye care professionals. During each webinar, practitioners will host discussions about a variety of relevant eye care topics, sharing insights, best practices for success in the current environment, and peer-reviewed and other pertinent research as well. This series will continue throughout 2021 as well. And this ECP Viewpoints peer-to-peer virtual learning series, these topics will be updated approximately every 12 weeks or so, and sessions covering each topic will be offered on multiple dates and times to accommodate your practice schedules as well. So for more information, please visit CooperVision ECP Viewpoints blog. So thank you once again, Dr. Drew, Dr. Jen, Dr. Jack, for your time and your insights over these last 3 weeks. I've learned a lot. I imagine the attendees have learned a lot as well. I also want to thank everyone for joining us as we discuss how these optometrists have made remarkable advances in their practices and patient satisfaction by leaning onto silicone hydrogel 1-days. Thank you everyone for your time, and have a great evening, and thanks again.
Thank you. Good night.
Yeah.
Bye.
Good night.